Hello, welcome to Medical Ward BSN 3F Group 2, third rotation NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our first week, and of course, our focus for this week or our case scenario for this week is patient AB diagnosed with septic shock. But before that, let me share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share with you our learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. Instructions. So this will be the instructions for your case study analysis. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. I've given you the templates already of your daily and weekly requirements. Please follow that. Save it as PDF file and submit all your requirements per group on date specified as its deadline. So of course, we will be having a set of deadline later on. Send all your requirements via the official email address of your clinical instructor. I'll be giving you my email address later on. It is advised that you will submit all your requirements on or before the set deadline of submission. Of course, it will be expected that you're going to submit all your requirements before the set deadline for you to have or for you to prevent from having point deduction from your score. Furthermore, kindly follow this format in saving your requirements for easier monitoring for daily requirements. Example includes Abang underscore Joseph underscore W1 D1 for day 1 and underscore NCM 116 early. Then Abang underscore Joseph underscore W1 D2 for day 2 underscore NCM 116 early. For weekly requirements includes Abang underscore Joseph underscore W1 underscore NCM 116 RLE. So please follow that one. Let's now have your case scenario of patient AB diagnosed with septic shock. Case history. Patient AB is a 42-year-old male, married with 4 children, a Roman Catholic in faith, and is currently residing at Barangay 24, Cagayan de Oro City. He is a member of the Roads and Traffic Administration or the RTA, and this is his work for almost 20 years now. He was escorted by his colleagues to the ER of MRXUH due to high fever. During the initial assessment performed by the nurse, it was found out that patient AB had urinary hesitancy and burning upon urination, accompanied with fever. When his wife arrives at the hospital and asks about the history of patient AB, she stated that he just doesn't seem like himself. The physician decided to admit patient AB under the medical unit for further evaluation and workup to rule out his condition. Patient AB was ushered to the medical unit of the hospital with proper endorsement made from the ER nurse. Further assessment was done and patient AB was noted to be weak. His face is flushed, his skin is warm and dry. He is oriented to person and place but states the year is 1952. His vital signs were as follows: BP of 99/60 millimeters mercury, heart rate of 92 beats per minute, respiratory rate of 28 breaths per minute, temperature of 38.9 degrees Celsius, SpO2 of 93%, height of 170.2 centimeter, and weight of 60 kilogram. The assigned physician to patient AB orders the following: blood work, CBC, BMP, ABG, lactic acid, blood cultures times 2. Order a urine test, urinalysis, urine culture. Diagnostics: CXR, chest X-ray, KUB, X-ray of kidneys, ureters, and bladder. Nasal cannula to keep SpO2 of more than 92%. Meds: 1 normal saline bolus, IV times 1 now. 1,500 mg of vancomycin intravenous piggyback times 1 now. Times 1 dose now. All blood and urine tests are completed and you initiate the fluid bolus for patient AB. You are still waiting for the vancomycin to arrive from the pharmacy. You notice he is more drowsy. He is now only oriented to self and feels warmer. You take another set of vital signs to find the following: blood pressure of 86 over 50 millimeters mercury, mean arterial pressure of 62 millimeters mercury, heart rate of 108 beats per minute, temperature of 39.3 degrees Celsius, respiratory rate of 36 breaths per minute, SpO2 of 88% on room temperature or room air. Patient AB's lab results have also resulted the following abnormal values were reported: WBC of 22,000 per microliter, lactic acid 3.6 millimoles per liter, pH of 7.22, PCO2 of 30 millimeters mercury, bicarbonate of 16 milliequivalent per liter, PO2 of 64 millimeters mercury. Urine is cloudy with sediment. Basing from the results of the test paid to patient AB, the physician diagnosed him of septic shock. The following orders were made by the physician: increased fluid volume replacement, parenteral nutrition or tube feeding, granulocyte transfusion, O2 via face mask, penicillin G 1 gram IVTT every 8 hours, PCM 500 mg 1 amp PRN for fever. You initiated all orders made by his physician and was able to reinforce your teachings to him and to his significant others. After 4 days of being admitted in the medical unit, his physician orders may go home. You initiated your discharge instructions and emphasized the importance of the take-home medications for faster recovery. Let us now have your high five critical thinking questions. Number 1. What is your priority nursing problem with patient AB? Why this problem? Again, what is your priority nursing problem with patient AB? Why this problem? Number 2. The wife of patient AB is worried about her husband and asks you how severe his condition is. What is your best response? Again, the wife of patient AB is worried about her husband and asks you how severe his condition is. What is your best response? Number 3. Patient AB was ordered to receive a granulocyte transfusion. What is the indication of this transfusion towards his condition? Again, patient AB was ordered to receive a granulocyte transfusion. What is the indication of this transfusion towards his condition? Number 4. Patient AB was discharged after 4 days of hospitalizations. What is your focus in his discharge plan? Again, patient AB was discharged after 4 days of hospitalizations. What is your focus in his discharge plan? Number 5. Patient AB was successfully treated and asks you, will there be chances of recurrence in his condition? What is your best response? Explain your answer. Again, patient AB was successfully treated and asks you, will there be chances of recurrence in his condition? What is your best response? Explain your answer. Let's now have your daily requirements. For day 0, that's at Sunday, that will be your case scenario loading. For day 1, Monday, basic requirements includes your GO, SO, DPA, Survey 1, Nurse's Notes, FDAR 1. Initial knowledge about the case, that includes your physical assessment, pathophysiology, diagnostic test, drug study. For day 2, basic requirement includes your SO, DPA, Survey 2, Nurse's Notes, FDAR 2, weekly evaluation, reflective journal reading, and also your critical thinking answers. Initial knowledge about the case, that includes your problem list, nursing care plan, and discharge plan. For your weekly requirements, these are the flow of your requirements. You have to have your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, and of course your references. That is going to be utilizing the APA style of reference taking. Deadline of submission. For day 1, deadline is March 22, 2021, Monday, 11:59 p.m. For day 2, March 23, 2021, Tuesday, 11:59 p.m. For week 1, deadline is March 27, 2021, Saturday, 11:59 p.m. Please make sure that you are going to submit your requirements on time. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details. My email address is jabang@xu.edu.ph. My number is 093104298842, and of course my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.